You've probably heard of a yeast infection, right? It's a really common thing. But what actually happens when a fungus that's supposed to be there, well, just goes wild? Today, we are diving deep into candidiasis.
Chào mừng quý vị và các bạn đã quay trở lại với kênh MediByte.
So here's what we've got on tap. First, we're going to break down what candidiasis even is. Then we'll get into that tipping point when good yeast goes bad. We'll cover the common signs you might see and then talk about what happens when things get more serious. And finally, we'll wrap up with how doctors diagnose and treat it. Okay, let's get into it. All right, first things first. What exactly are we talking about when we say candidiasis? You might be surprised to find out where this infection actually comes from. Put simply, it's a fungal infection, and it's caused by a type of yeast called Candida. There are a few different species, but the one you hear about most often is Candida albicans. That's the main culprit. But here's the really fascinating part. Candida isn't some outside invader. It's actually a totally normal part of our body's microbiome. It hangs out on our skin, in our gut, our genital tract, and usually it's completely harmless. It just minds its own business. So that leads to the big question, right? If this yeast is just a normal resident, what makes it suddenly turn on us and cause an infection? Let's talk about that tipping point. So what is it that disrupts that delicate balance? What gives Candida the green light to just start growing out of control? Well, turns out a few things can give Candida the upper hand. Taking antibiotics is a huge one, because while they're great at killing bad bacteria, they can also wipe out the good bacteria that keep Candida in check. Other big risk factors are things that weaken your immune system, like cancer treatments or advanced HIV. Even things like diabetes or being pregnant can shift the balance. Okay, so what does this actually look like when it happens? Let's get into the most common signs and symptoms. We're talking about what are called superficial infections. They're annoying for sure, but they aren't usually dangerous. And one of the most famous types is oral candidiasis. You've probably heard it called by its more common name, thrush. If you have thrush, you're looking for some pretty classic signs. You might see these creamy white patches inside your mouth. They can be pretty painful. Sometimes you'll get cracks at the corners of your mouth, or your tongue might get really red, smooth, and sore. And it's not just in the mouth. Candida can cause skin infections too. These usually show up as a nasty, burning rash. And a little fun fact for you, some of those stubborn diaper rashes on babies, yeah, that's actually a Candida overgrowth. All right, so we've covered the kinds of infections that are localized and treatable. But there's another side to candidiasis, a much, much more serious one. Let's look at what happens when this infection decides to spread. And you can really see the difference right here. On one side, you've got superficial candidiasis. It's stuck in one place, it's a nuisance, and it can happen to pretty much anyone. But on the other side, that's invasive candidiasis. And that is a whole different ballgame. It spreads through the body, it can absolutely be life-threatening, and it almost always happens to people who are already really sick. See, when Candida breaks out and gets into the bloodstream, it can go anywhere. We're talking about serious damage to your heart valves, your brain, your spleen, your kidneys. It can even get into your eyes and, in the worst cases, cause blindness. When it gets into the blood like that, it's called candidemia. This is actually the most common type of invasive candidiasis, and it's a huge problem in hospitals. It's one of the leading causes of bloodstream infections, and if doctors don't catch it and treat it fast, it can be fatal. So, with this thing ranging from a simple rash to a life-threatening condition, how do doctors even figure out what's going on? And more importantly, what's the path to getting better? Let's talk diagnosis and treatment. For the simple stuff like thrush, a doctor can often tell just by looking. But to be sure, or for anything more serious, they're going to dig deeper. That might mean taking a little scraping to look at under a microscope. They can also try to grow the fungus from a blood or tissue sample, or even use fancy blood tests, like a PCR test, to hunt for Candida's DNA. Now, the treatment really has to match the problem. For those localized infections, on the skin, in the mouth, antifungal creams, or maybe an oral pill like fluconazole usually does the trick. If it gets into the esophagus, you'll need stronger oral meds. But for those systemic, bloodstream infections, that calls for the big guns, powerful antifungal drugs given through an IV. And this really highlights a crucial point from the medical community. A person's overall health is a massive factor. If someone already has diabetes or a weakened immune system, the infection is just plain harder to fight off, and it doesn't respond as well to treatment. All right, so let's just do a quick recap. The big things to remember are Candida is totally normal until it isn't. Those superficial infections like thrush, super common, very treatable, but invasive infections are a medical emergency. And finally, treatment is never one size fits all. It has to be tailored to the specific situation. It's pretty wild to think about, isn't it? This whole complex ecosystem is just humming along inside of us. And it makes you realize how something as simple and common as a course of antibiotics can totally throw a wrench in the works. It's all connected.